Dear colleagues, welcome to the OncoAlert Roundup for the week of November 15 to the 21st, 2024. Here are some highlights of the week, and for more in-depth updates, we invite you to sign up for our newsletter by clicking the link in the post or visiting www.oncoalert360.com. That's www.oncoalert360.com. Starting off with a spotlight publication out in New England, the Goteborg trial in prostate cancer. This population-based trial found that MRI-targeted biopsies in prostate cancer screening for men aged 50 to 60 with elevated PSA levels reduced the detection of clinically insignificant cancer and overdiagnosis without increasing the risk of missing advanced disease, while maintaining similar detection rates for clinically significant cancer. Also in prostate cancer, the TITAN trial. In the TITAN trial, metastatic castration-sensitive prostate cancer patients treated with apalutamide who achieved ultra-low PSA levels early experienced significantly better clinical outcomes, including longer survival and delayed disease progression. Out on Nature Communications, matching patients to clinical trials with large language models. TrialGPT is an advanced framework that uses language models to efficiently match patients to clinical trials, significantly improving accuracy and reducing screening time in the recruitment process. And now moving on to lung cancer. Out on JAMA Oncology, the EXENTORCH phase 3 trial shows that adding toripalimab to chemotherapy significantly improved progression-free and overall survival in patients with extensive stage small cell lung cancer with an acceptable safety profile. In breast cancer and out on JCO, the OPAR study found that both 30 grays and 27.5 grays once daily partial breast irradiation regimens resulted in acceptable cosmetic outcomes, with the lower 27.5 gray dose being selected for a phase 3 trial due to fewer adverse events and lower late toxicity. In ovarian cancer and out in Lancet Oncology, the CHIPOR trial. It found that adding hyperthermic intraperitoneal chemotherapy, or HIPEC, to cytoreductive surgery for recurrent epithelial ovarian cancer significantly improved overall survival despite a higher incidence of severe adverse events. In CNS metastasis, PULSAR out in the Red Journal by Astro, the combination of personalized ultra-fractionated stereotactive adaptive radiotherapy, or PULSAR, with central nervous system active drugs showed excellent local control and low toxicity in brain metastases, particularly for larger tumors, warranting further investigation. Out in the Lancet Oncology, effectiveness and safety of immune checkpoint inhibitors in Black patients versus white patients. Black patients treated with immune checkpoint inhibitors in the U.S. Veterans Health Administration system had similar effectiveness to white patients, but experienced fewer immune-related adverse events, suggesting a potential more favorable therapeutics ratio. And finishing off with one of our partner journals, ACS Cancer, Global Disparities in Cancer Care. This review examines the rising global cancer burden, particularly in low-income countries, and proposes solutions such as cost-effective screening, price discrimination, and international funding to address disparities in access to cancer treatments. And there you have it, folks, this week's Roundup. We look forward to seeing you next week for yet another great week in oncology.